morning. Hello, everybody, and welcome back to night 2 of Everlasting Hope's National Infertility Awareness Week annual speakers, virtual speakers. I don't know. We don't even have a name for it, but I am super excited for tonight. Natalie with Prairieland Counseling is joining us. She is a counselor. She's also a partner in Hope of Everlasting Hope. So thank you, Natalie. Without sponsors like you, we could not do what we do and have the mission that we have. So extra big thank you to you for being a sponsor. And for those that might be new to Natalie, she is actually a licensed counselor in North Dakota and Minnesota. And a silver lining of COVID, I like to call it as a fellow medical profession, is that you can seek services through Natalie via telehealth, correct? We're still good with that? Good. So that's, as someone who lives in rural North Dakota, I just think it's super special to have that service available. And especially for those going through infertility, we like to, we'll get to that later, but it's hard to want to probably walk into another clinic, another waiting room, and just you can have service like yours available from the comfort of their own home, their car, their work office, close the door and see you. So I am super big as a fellow healthcare provider on making sure people have access to mental health, taking care of our mental health no matter what we're going through. I like to do big shout outs and personally share that. I go to counseling, like you're my neutral zone of life that's HIPAA protected. And so I just think to break down barriers and stigma around mental health in general, but especially when it comes to infertility, because we know that it's the fourth leading cause of trauma in women, and 61% do not even tell their friends and family they have this diagnosis. So one thing at Everlasting Hope that I really want us to shine a light on is just the mental health. And so in addition to just being a licensed counselor, you also have specialized training as a counselor through ASRM, the Covington and Applegarth, did I say that right, method?
Yeah, well, so Covington and Applegarth literally wrote the book on infertility counseling, and so I'm doing a special course with them and learning all about. And so it's a great course. It has people from around the world, so not just fertility practices here in the U.S., but also around the world, and just how we help support people.
That is amazing. So I'm going to roll it over to you. Let's just dig in. Let's start though with, why did you choose to specialize in infertility for counseling? You could have picked many things, right? Like, what made you do this one?
Yeah. So when I was 18, I was diagnosed with endometriosis, and I had a laparoscopy. And one of the things that they told me at the time was, this might make getting pregnant difficult. But I was 18. I was like, I don't even know why you're talking to me about kids. This isn't a thing. Fast forward 10 years, and my partner and I are trying to get pregnant. And it's just not working like it's supposed to, in quotation marks. And so we ended up going through fertility ourselves. And while going through the process, I just really noticed that there didn't seem to be any, if at all, like almost no discussion on just like mental health and how it was being impacted. We were able to achieve pregnancy, and even during that process.
Natalie, Zoom
Yes.
connected me to my personal Facebook page. That is why we're live.
Oh,
So I'm going to roll us over to Everlasting Hope. I think. Hold on, we're going to keep recording because
okay.
this is good stuff. I am just going to stop the live. If you're watching the recording of this, like, cool, you, like, I had this all connected. I told you, Natalie, beforehand, like, I'm tapping out on.
It's a thing. Like,
Oh,
I mean, computers these days.
Oh, I found the problem. Found it right here. Okay. Hope you're enjoying this if you're watching the recording of this. Oh, I'm just gonna just like spiel it all out.
Can you just like edit it so it like cuts?
I probably can. I'm gonna have to like, I will probably figure that out. Okay, there we go. We're gonna go live on the page now that we're supposed to be on.
Oh, okay.
Seriously. Well, I don't know how it even, oh, I wonder if it just earlier today. Okay, we're connecting. We're redirecting. We are live. Okay, we're good. Maybe. Let's see. I want to make sure we're on Everlasting Hope's page. Okay.
Well, at least like
We're
now you're,
live on Everlasting Hope now.
woo.
Can I just say to all the techie people in the world, you're amazing. We were just live on my personal page. So there we have that. So I'm just gonna do a quick, we're just gonna do a quick recap of what was just live on the wrong page. Love you, Zoom.
Yes, the
Okay,
best.
so day 2 of National Infertility Awareness Week with Natalie of Prairieland Counseling. I'm going to try and clip and edit and add because we just had like a super good, at least 2-minute conversation before I discovered we're on the wrong page. So I have Natalie, Prairieland Counseling. She's a partner in hope of Everlasting Hope. Thank her profusely because without partners like her, Everlasting Hope could not do the work that we do. So in addition, mental health is huge with not just infertility, but our health in general. And one thing that we want to do at Everlasting Hope is really remove these barriers and stigma to mental health that surround infertility and beyond, and make sure people have access to high quality healthcare here in North Dakota. The wonderful thing about Natalie is she is licensed in North Dakota and Minnesota. Silver lining of COVID, you can access her through telehealth. So no matter where you live, you have access to a wonderful counselor who has gone above and beyond, and she's certified through ASRM and, hold on, I have it right here, Covington and Applegate, which explain what that means. What does that mean, Natalie?
Yeah, so Covington wrote the textbook on infertility counseling, and so her and Dr. Applegarth are two providers located on the East Coast, but they actually host a intensive class on infertility counseling once a year. It's for people around the world, and so we get together and just learn about fertility practices kind of around the world and just how best to support people and partners who are going through the fertility experience.
Amazing. So above and beyond you have taken. So in addition to that, like what made you go and get this extra certification? Like what made you become passionate? What's your personal connection to infertility? And if anyone has any questions, please leave them in the comments or message us. I'll be watching the comment section, and then you can always ask us questions afterwards too. So we will, if you want to message us privately, I'll be watching that as well. This is an open time for you to get your questions out there and have them answered too.
Yeah. So at 18, I was diagnosed with endometriosis and I had a laparoscopy. And, part of the debrief was, this may make things difficult for having children, or difficult to conceive when you have children or decide to have children. And of course, I was 18 and didn't care at all. But fast forward 10 years, my partner and I were trying to conceive. It was starting to become very difficult, and we kind of went through our own journey with that. And so we ended up doing fertility treatments. And I just noticed at that point, I'd been a counselor for about 7-8 years. And so it really hadn't dawned on me. But as I was going through the process, I just really noticed that nobody was really talking a whole lot about mental health. We were able to achieve pregnancy, and even during, the pregnancy, there was very little discussion about like perinatal mood or anxiety disorders, postpartum depression, things like that. So I ended up actually becoming a birth educator and trying to kind of, again, talk about mental health in a different way with expecting parents. And again, there was like one slide on it. And I just felt like there was just more conversation needed to be had just about reproductive mental health. And so that's how Prairieland Counseling was formed.
That's amazing. And I agree, like even from my perspective in the medical field, there's just so much work that needs to be done to bring education about on infertility and mental health in general too. So you have a personal connection. And so thank you for sharing that, because we're
Yeah.
really big too about, we want to guide people through their journey of sharing if they never have shared as well. Do you have any insight on what that could look like, or any insight on information on that?
Yeah, one of the things that we do talk about, in counseling is just, like who is privileged to hear your story, Who do you feel safe with about sharing that story and sharing that information? And really that's the place to start is, talking about your story with people that you trust, and that are willing to be just kind of open and hear what you have to say, and kind of support you through it, because it's really hard to talk to people who might be invasive or ask questions that don't feel appropriate or just don't feel like a safe space, especially if you're just starting to talk about it for the first time. So really, talking about your story and your journey and knowing that nobody is entitled to that information. I think being in reproductive health, I've obviously been trained to like not ask questions about, people's reproductive experiences unless they want to ask me. But even if we're in a counseling session, I really try to be respectful and be like, can I ask you about this? This is something that we can talk about. I might ask like one or two brief questions, but going deep into the information, that's something that is entirely up to you. And obviously, the more people that you find that you tell, the more that people tend to be like, I also went through something like that, or we also had these difficulties. And I have found more people than not find some sort of connection or link with people when they share their stories.
Absolutely. I think that personally, I have found that to be true as well. So tell us, I guess, just what are maybe three things that you commonly find reoccurring in your sessions or counseling sessions, or things that you'd like to just share to people who might be listening who haven't started, counseling or working on their mental health yet, or just anything that you can think of that would guide them maybe more in that direction.
Yeah, I think like I do quite a few psycho ed sessions for those who are going to use like donor egg, donor sperm, or surrogate. And so many times a clinic will kind of recommend or require an evaluation and or a consultation, I should say. And, the purpose of things like that is the purpose with somebody, coming into counseling is really just to be as well informed into going into the process and provide you with some support. So, wherever you're at in the process, finding somebody who has some training in infertility specifically, who can understand, what the difference between an IUI versus IVF is, some of those even just basic terminology pieces, what it looks like, what does embryo grading look like, just all of these different pieces that kind of come together. Having somebody who is trained or knowledgeable in some of those things can help you just understand the process yourself, can help refer you to the kind of right people. But really, it's to provide you a support place where you can come and say anything you want and just know that you're not going to be judged. And I think that's a really big piece, especially when you're going through fertility, is that, or infertility, is that, a lot of times, like there's a lot of frustration both with like our bodies, ourselves, our partners, our sister-in-laws who just seem to get pregnant with no problem, or a parent who maybe asks an insensitive question, but you don't necessarily know how to talk to them about it, or an upcoming holiday gathering where everybody's going to be passing around photos and you just, you're going to be asked the question once again, when are you going to have kids, or what's your plan, or when is that going, and so counseling just really allows us to help us identify what is it that we want to say, even if they, the answer is, that's kind of a personal question, and knowing that even to family members, that's an answer you can have.
So you kind of answered. I was just going to ask you, how do we deal with those comments when they come? I think you kind of just touched on that, but anything else that if you've just swallowed it every time and swallowed it, what could be a beginner sentence even, or a paragraph that people can use?
Yeah. I think a bit, the most basic sentence is just like, that's a really personal question. I don't feel, that my partner and I have decided to keep the discussion between the two of us. And it can be just as simple as that. Depending on how comfortable you are with sharing your story, sometimes it can be a teaching experience, or if you are comfortable saying, they're like, hey, when are you thinking about having kids? Like, actually, we've been trying for a while. And that's a pretty sensitive topic. I know that you really mean well, but sometimes it can be can be kind of hurtful to be asked those questions, especially if we're kind of going through the process or have just recently had a loss or a failed cycle. And failed cycles are losses in and of themselves.
Absolutely. I want to shout that from a mountaintop. And something kind of neat that happened in my little small town at my hospital is we actually turned the bereavement policy into include miscarriage and failed embryo transfer. So if we can do that in my rural community, let's make a movement. Willing to help you guys make that action step. That's
Yeah.
something that I think is needed because that is a loss as well. And I think that gets forgotten. So just to know and acknowledge that, I think as a loss too is very important. There was one question that came through so far. Do clinics connect you with a counselor if you are going the donor route, or can you choose your own?
So it depends on like what necessarily you want. Like if you're coming for like a psychoed consultation, I think there's only 3 of us in the state who do them. But if you're just going, wanting ongoing counseling, you can go to anyone. There are just, a lot of really wonderful people out there, and just, asking questions, asking if you can have even just like a free consultation. A lot of us do like free 15-minute phone consultations just so you can ask questions or feel comfortable with us before, we ask some pretty personal questions, and so when it comes to counseling, what's really interesting is they've done tons of studies, and it's like, what's the right method or what's the right, way to kind of treat people? And the truth is that that matters very little. The most important part of counseling is your relationship with your counselor. And so knowing that you have the right to ask questions, knowing that you have the right to change counselors if you're not comfortable with them, that is totally okay and within your rights, and you should do it.
I tell my patients that all the time. I'm like, give it 2 to 3. And if you are not connecting,
Mm-hmm.
don't just stop counseling altogether.
Yeah.
Let's work at finding you a new one. We have a whole list of ones that we can connect you with. Same goes for this. Now you talked about, is there special training for donor conception that they should look for if they're trying to find one?
So a lot of the donor conception training does go through ASRM.
Okay.
And if you're a counselor who wants to go through some of the training, they also have a mentor-mentee program, which I participated in as well. And that can kind of help you go through how to like conduct evaluations and things to cover. Also, like the course with Covington and Applegarth is something that we
Okay.
covered in that as well.
You're getting some shout outs in here. Natalie is an expert at connecting and you rock.
Oh,
Yay, she does.
thank
She does
you.
rock. So let's talk about, I mean, I think I have so much with this. And I had so many questions as you were talking. Just so you guys, if you're just joining, make sure you can let us know any questions in the comments or ask us later. I'm watching the private message as well. So let's talk about acknowledging feelings. They are valid. We maybe second guess them with infertility because there's no insurance coverage and it's elective, so it mustn't be valid. There's
Right.
that whole side of it. Or there's just so much that I feel happens prior to the diagnosis of infertility that brings on emotions. So how do we work through some of that?
Yeah, like that's a really great question. And I think it's kind of it's a tough one in the sense that a lot of us, especially when we're like, dealing with like losses prior to being, like the misconception that you have to have, like 3 different losses before you'll even get the referral. We can change that. And it's really about advocating and listening to your body. If it feels like something isn't right, then talk to your doctor. And then if it feels like they perhaps are not listening to you in the way that you want to be heard, then calling one of the fertility clinics and asking if you need a direct referral or if you can refer yourself or do a self referral. And so really being aware of that. If something just doesn't feel right, if you feel like you need some sort of workup, and then also understanding that, for those who are just struggling to achieve, pregnancy, um, they there's a recommendation usually like up to a year if you're under 35, I believe, and 6 months if you're over. But again, asking about that process, is this kind of like something that has to be done this way? But acknowledging your feelings is a really important part of it because it allows you to kind of just let go of the feeling or work through the feeling. Um, Kristen Neff, she has a PhD in psychology, and she does a lot of work with self-compassion, which is a big, big piece when we're talking about infertility counseling. She has one of my favorite meditations of all time. It's called Soften, Soothe, Allow, and it's just about acknowledging where the feelings are within our bodies and just giving ourselves some grace and kind of letting it go a little bit. They're speaking just kind of about mindfulness or meditation. There's two really wonderful apps. One is called Mindful IVF and one is called Calm. And what's cool about all those is that they help you like through a lot of the specific time periods, like the 2-week wait while you're waiting after transfer and waiting for results, or just dealing with loss, or struggling with conflict with partner or family. And so those are some really wonderful resources. Some of them you have to pay for, some of the things, some of them you don't. But really acknowledging how it makes you feel, understanding that even if you have a feeling that's like, I can't believe I'm saying this, or I feel frustrated that this is part of my experience, like, emotions are not good or bad, they just are. And it's what we do with them that makes them good or bad. And again, that terminology is just very black and white, but we're islands in an ocean, there are always waves.
Like that. That's a good analogy of that all.
Yeah.
So good.
Yeah. And so we can't just be like, oh, there aren't waves today. Well, that's not impossible. There are always emotions.
Right. And like you said, it's what you do with them as they
Mhm.
arise, infertility or otherwise.
Right. Well, it's like I get mad, not everybody who gets mad punches a wall. Like we all experience this universal emotion, but what we choose to do with it is very different.
So you said something else that I want to talk about at whatever level we can.
Yeah.
Marriage and infertility. They want this, I want that. What are some tips for couples that might be just feeling the pull and the struggle of infertility?
Yeah.
That's a loaded question. I'm
It
well
is a
aware.
loaded it is a loaded question, and I'm gonna go a little PG-13 here. So if you
Yeah,
have small
so
ears or
cover the ears.
yeah,
It
you
needs to
know,
be talked about, right? I don't
it
know how else
does.
to
It
say it.
does. Well, I think, understanding number one, that oftentimes, collateral damage in fertility treatments is intimacy in relationships. And, you know, when your body comes like this science experiment, oftentimes we disconnect from it ourselves. And so even if like frequency of like, let's say sex doesn't decrease necessarily, our enjoyment or pleasure or connection with it certainly can. And so knowing just that intimacy is a lot more than just an act or one specific thing. Intimacy is about connection with your partner. And so talking about, how is this making you feel, allowing your partner to say things and not necessarily immediately being like, oh, I have made them feel this way. Oh, it's my fault. Oh, I have failed. But just kind of, again, trying to allow them this neutral place to just be heard, and also trying to have that for yourself. And if that's not possible, because a lot of times it's not and it's very difficult, that's where something like counseling can really come into play. And we work with couples on like, how do we manage this and how do we introduce this, and because you guys are each going through a grieving process of what you thought life was going to be like, and it's going to be it looks a little different, or the way to get there is going to look different. And so, we talk about that, and we talk about how we manage our grief, because, when you have two people who are grieving, a lot of times there's a lot of friction.
That's perfect. And is there a tip or two you can think of if one's on a complete different page with treatment? Or taking a break, even talk about taking a break in between treatment, anything like that.
Yeah, I think it's always really, really important to make sure that you're understanding very clearly what they're saying. Because oftentimes people hear, I want to take a break as I'm quitting, I'm completely done. And that's not necessarily what is actually being said. And so you can kind of use, that reflective listening, like, so what I'm hearing you say is that you don't want to do this anymore at all. And that then allows for them to kind of come in and be like, nope, that's not what I said. What I'm saying is that I would like to put a pause for 30 or 60 days. Okay. The other really important thing is to understand like the meaning behind it. Like, why is it that you want to pause for 30 or 60 days? Or why is it that you want to, stop treatment? Or why is it that you want to, go for one more IVF round or something like this? Because that's really what we're going to what we need to understand in order to kind of work through it. Is it, I see you become upset every time we have a result that isn't necessarily something that we want. And so it hurts me so much to see you upset. Okay, that's why, then let's work on that. And so really understanding like what the meaning is behind why they're saying what they're saying or what their answer is very important.
I love that. That is so good. I'm just watching the comments. There's no comments, but lots of people watching. So that's so nice to see. We just hope
Yeah.
that tonight's session just helps break a little bit of your wall
Yeah.
down if you had one, open you up to the idea of seeking some counseling or support services of any type when you're going through it. Everlasting Hope has, of course, if you're on Facebook watching this, we have support groups that are wonderful
Mhm.
inside. We do have every third Monday of the month a counselor that meets in person in Bismarck, and we just stream that virtually. So make sure to join that. But most importantly, maybe finding yourself your own personal counselor. And you mentioned couples counseling. Is that something that you do as well? How does that look if someone wants to start alone? Do they come together right away, or how does that look?
So, that's kind of a sticky wicket. I think, each different um, field, like social work, like psychologists and counselors, all have like kind of like their own different way of approaching it. Generally, if I'm seeing somebody individually, I will not also see them as a couple. Because then I already have a relationship with one part of the couple. And so then when you sit down and you try to be neutral for both, it's really difficult. I know there are some professions that are just like, yep, this is just how you do it. So if I'm working with somebody individually, I generally do not see them as a couple ongoing. I might bring in the partner for like 1 or 2 sessions if we're trying to clarify something or work on a specific theme or make a specific plan. But ongoing, I would refer them out.
Awesome. So let's close with one thing I'm thinking of. What are some, mindfulness things or relaxation techniques that people can maybe implement at home? One of my favorites is meditation before bed. I know there's tons of fertility meditations as well, but what are just some self-care things people can do daily while going through infertility?
Yeah, so I think a great one is actually a progressive muscle relaxation, where you start to relax your body from the top of your head down to the tips of your toes. And one of the reasons that I really love that is that it really keeps us in tune with our body. Because again, we so often, one of the most common reactions to trauma is to just detach from our body because trauma is stored in the body. It's not just stored in our head. And so progressive muscle relaxation is really helpful in that we go through our body, and a lot of times it allows us to check in with where our body's at every day. Like, oh, I'm really tight in my shoulder today, or I'm really clenching in my jaw, which I think is just really wonderful. There's also some wonderful massage therapists who specialize in massage specifically for infertility treatments. There's Arvigo and Mercier. And so, if doing massage is helpful, some sort of body work, myofascial release is helpful, acupuncture can be helpful, but just a way to really like connect with your body. People like Reiki, energy things, like whatever it is that, allows you to feel relaxed and just in touch with your body is really important.
I love that. I'm a huge acupuncture fan personally.
Yeah.
I was just thinking, oh yeah, I'm a little stiff. I should
I know.
probably.
I was just like tighten my shoulder, trying to relax.
Like, I think people need to realize, like, you just don't get sore. It's probably it's where you're storing your stress. Plain and simple. Like, you have an achy back and shoulder and neck because you're a tense individual for the day or what has something's going
Yes. Yes, chiropractic work. A lot of
on.
people, there's chiropractic work, and I think again, like it really is about making sure that your body it feels good, and that helps with your mental health, and your mental health also helps your body feel good. It's holistic. They impact each other.
Absolutely. Well, thank you so much, Natalie, for
Yeah,
joining
thank
us.
you.
Where can people find you? And is there anything else we left out that you'd like to close with?
So I'm at prairiellandcounselingfargo.com. And I think the most important thing that I hope that you guys take away from tonight is just that um, for infertility can be so isolating. Don't let it. You know, reach out, talk with somebody, even if it's somebody that that is not necessarily in your inner circle, sometimes that's even better. And know that, our job as counselors and therapists is just to support you. That's the most important thing.
I love that. Goosebumps. You're getting a lot of thank yous on here. So we thank you to
Good.
Everlasting Hope. We're going to bring you back. Little do you know, I'm going to tell you now, we're
Okay.
going to try to start some more series like this beyond Infertility Awareness Week. And once again, I've said at the beginning, mental health is so very important. So
Yeah.
we look forward to having you back. So thank you everyone for joining. Make sure you can watch this later. You can watch it again. You can share it as well. It'll be on our website, YouTube, of course, saved on Facebook. And just know you're not alone, right?
Yes, 100%.
Have a good night, everybody.
Bye.